Well, good morning. Nice warm fall day here in Boone. Never know what to expect. We were talking earlier. If you don't like the weather, wait 2 hours and it'll be something different, and we all know that. Before I get to my assignment this morning, a couple of pieces of family business for the Appalachian family. First, I want to recognize one of my colleagues from BlueCross BlueShield of North Carolina. We have what we call our senior leadership team, which is the top 8 senior leaders. You'll be proud to know that 25% of those seats are occupied by Appalachian graduates. So my colleague, our Senior Vice President for Sales, Marketing, and Communications, John Roos, is here. He serves on the advisory board with the business school. I want John to stand up and wave at everybody. John Roos, another proud mountaineer. The reason I wanted to point John out is if we have time for questions, if I can't answer them, he will. And all of the students that are here that want to join the BlueCross BlueShield of North Carolina family and increase that percentage at the senior leadership table one of these days, see John after we finish this morning. Let me thank both deans for the gracious introduction and their leadership of these 2 wonderful colleges, that the business school having catapulted Appalachian to rankings such as the chancellor referred to earlier, and now the new College of Health Sciences, which will indeed move us ahead of many other institutions, including our brethren around North Carolina. 2 more items of family business. I want to thank Chancellor Ken Peacock, who is in his last lap here at Appalachian, and there will be plenty of opportunities in the coming months to thank he and Roseanne and reflect and think about all the wonderful things that have happened here in Boone because of their leadership. But I wanted to take a minute this morning to thank him for his inspiration, for his energy, which is perpetual, for challenging us and leading us with integrity and with commitment here at Appalachian State. So, Chancellor, we're here today to also celebrate your visionary leadership, because this indeed is the first College of Business and College of Health Sciences joint lecture. And let me suggest that if there's ever been a time for the healing arts and the best practices of business to come together and have a common conversation, it is now. And we're going to talk about the revolution in healthcare in just a minute. My last piece of family business is I want to speak directly to the members of the faculty that are here today, along with the administrators and all of the staff, wherever you may be found here in the Holmes Center. On behalf of all rounded up 9 million North Carolinians, I want to thank you for your hard work and your leadership as you continue to lift the spirit of students, to stretch their mind, to prepare them for this global knowledge-based economy, to make sure that Appalachian students are ready to meet the challenges of the future. And you're doing it at some of the toughest times in the history of the Consolidated University of North Carolina. And I want to thank you for sticking with it and staying at it. And I want to remind all of us that our state has always been distinguished in this country for lots of reasons, one of which is the 17 crown jewels that comprise the University of North Carolina. And we all need to, as mountaineers always do, stand in the gap and make sure that our university gets the resources and the time and attention that it needs to continue to be the differentiator for North Carolina in the world. And as our president, Erskine Boyles, former president, often said, The biggest and best asset we have in this university are the minds of our faculty. So thank you for continuing to deploy your time and talents on behalf of all of us in this very tough time in the life of the university, and we will come out of it even stronger. Now, my assigned task today was to talk to you a little bit about health care. Have you heard anything about health care recently? Seems like there's no other topic on the planet other than health care. And what my goal is, we could spend all day, which you do not want, talking about health care and the various aspects of it and the complexities that we currently face. I'm going to leave you with a few themes and some examples of what's going on here in North Carolina that our company is proud to be a part of and lead. So think with me, if you will, about the construct. This indeed is a revolutionary time in health care as we all come together and try to figure out new ways to improve quality in the delivery of care and lower cost in order to get more value out of every dollar that we spend in health care. Now, I'm not just talking about the Affordable Care Act. You know, there was health care before there was the Affordable Care Act. The Affordable Care Act, of course, is a major piece of it, but it is a piece of legislation. And it is indeed the law of the land until it is not. So the political debate can and will continue. But I would suggest to you that while that's going on, all of us need to focus on health care, higher quality and lower cost. All of us across the country that have an opportunity to be in our various leadership positions have been working hard to develop new models for how health care is delivered and how it's paid for. And I'm going to give you some illustrations of that today, and that is indeed what we have been about at BlueCross BlueShield of North Carolina. So, as we start, I want you to think about this as a conversation, not a lecture, and I hope we have time for dialogue at the end. So let's talk about the challenge. The Chancellor started with some facts this morning. Let me give you some facts that are not part of any political debate. As a nation, we are spending more than $7 billion a day on health care. And that number is going to go up. If at the current rate of increase, health care spending will be 20% of the gross domestic product of this country by the end of this decade. And what that means in terms of your pocketbook, regardless of your age, whatever salary that you earn after graduation, students, and whatever the W-2s look like for the rest of us who happen to be employed today, that means 1 out of every $5 in your wallet is going to be spent on health care, whether you're spending it or not. That is an unsustainable economic model for this nation, and it is an unacceptable and unsustainable economic model for us as individuals. Now, what are we getting for our $7 billion a day? We are, in fact, getting a lot of wonderful care being delivered by hardworking medical professionals in cooperation with wonderful hospital facilities across this country. That's part of the good news. We have life-saving pharmaceutical therapies and therapies that help us remain healthier longer. But I'm going to submit to you that notwithstanding that strong record of success, we are not getting the value out of the $7 billion that we're spending. Think about more facts. Life expectancy in the United States is 38th in the world. We do, in fact, and we proclaim to have the best health care in the world, and the value proposition is yielding that daunting statistic. We have fewer physicians per 1,000 people, 2.4 doctors, than most other developed nations, hence the need for a College of Health Sciences here at Appalachian. And our own bad habits are making things worse. The obesity rate in the United States is far higher than most companies. And think about this data point. At Blue Cross, rounded up, we pay about $12 billion a year in health care claims for our customers. $2.4 billion of that is directly related to conditions caused by smoking, overweight, and obesity, almost 25%. And we have a system that rewards and pays doctors and hospitals for the volume of procedures they provide, not for the value and the quality of the care delivered. And that's part of the revolution, and that's where the conversation is going. So the bottom line is, we have a need for a new model in our healthcare system, one that is more patient-centered, more collaborative, innovative, and effective. So how can we make it better? What are some of the solutions? Well, recently, most of the conversations begin and end these days with the Affordable Care Act, and indeed, it has stimulated and accelerated and triggered much of the revolutionary activity that we are experiencing. And it is one of the most pervasive and comprehensive pieces of federal legislation in the history of our country. The ACA increases coverage and access to health care, and we can all agree that more people need to have the means and access to better health care, and that's a great goal. But it's not free. It comes with a cost. It doesn't magically all of a sudden become less expensive because we address some of the access issues. And let me give you some examples of that. There are 8 new taxes and fees embedded in the ACA. All of you who are in business or aspire to be in business, when your overhead goes up, what does that do to your price point, and where does that price point end up? It ends up in the marketplace. There are added health care benefits for consumers. In other words, the benefits that the ACA required that be embedded and a part of health insurance is bigger than it was before. That costs money. And there will be more unhealthy people entering the system, and that will require greater degrees of medical attention for them, and that's a good thing, but it comes with a cost. So the ACA has definitely accelerated our discussions about improving our system, but it is not the only game in town. Reformation began far before the revolution began. So let me give you a couple of examples of things that are happening right here in North Carolina. And you should be very proud of North Carolina because the nation is watching what we're doing here. North Carolina, our wonderful provider community, and I'm proud to say our company and many others are leading, trying to figure this thing out, coming up with innovations, and the eyes of the country are watching what we're doing. At Blue Cross, one example, we have partnered with the UNC healthcare system to develop a new type of medical practice that's called Carolina Advanced Health. Go Google it. You'll learn a lot about a new way to do health care. We opened up the doors jointly with the UNC healthcare system in Durham and Chapel Hill almost 2 years ago. And what it does, and we could spend an hour talking about it, but fundamentally what it does, it brings together medical professionals, doctors, PAs, nurses, who put the patient at the center of a team. Primary care, pharmacy, mental health professionals, nutritionists, and case managers. It's a one-stop shop, if you want to think about it in that regard. And it's getting dramatic results. For the first year, there were 0 avoidable hospital admissions out of the patient cohort from Carolina Advanced Health. There were 64% fewer emergency room visits by the patients who go to Carolina Advanced Health as compared to BlueCross BlueShield customers as a whole. And most importantly, the patient satisfaction, reaction, and scores are off the charts. One note that I got from a woman said, "Can you tell me why medicine hadn't been practiced this way in the last 40 years?" Another way that healthcare is changing is through something you may have heard about, accountable care organizations, ACOs. Now, I say that when you've seen one ACO, you've seen one ACO, because it has become a catchphrase for all kinds of innovative things that are going on. But fundamentally, an ACO lines up incentives so that the hospital and the doctors get a share of the money that is saved as a result of better care delivery when it is in fact delivered in an efficient, high-quality manner. Our company is involved in 5 of these across North Carolina. One, a most recent exciting new development, is in Wilmington, where we have come together with a large independent physician practice and New Hanover Hospital and BlueCross BlueShield, all at the table developing an ACO model that I'm convinced will in fact deliver higher quality care to the patients in that area at a lower cost. Another example of an innovation is what you may have heard of this too, episodic bundled payments. What that means very simply is that the health plan, Blue Cross, pays the hospital a set rate for an entire episode of care. Then, it's up to the hospital to manage that care efficiently. If the hospital does so, and they do it at a lower cost than that which we have paid, they keep the difference. If, however, it's not handled in that way and the cost goes above what it is that we have paid, then it's up to the hospital to cover that cost. And you do not get an additional bill beyond that flat amount. We have a number of those in existence around North Carolina, one of the most recent being knee replacement surgery at Duke. Now, I could give you many, many more examples of innovations that are going on, and it would be far beyond the time that we have and more detail than you probably want to hear about this morning. But the key takeaway here is that we have all come to realize, we being all of the players in the healthcare system, that we can't go off independently of each other and chart our own path and expect to be successful. We have to work together if we're going to make the whole healthcare system better. And you know, I think that we have an advantage in North Carolina when we start working that way, because that's the way we do things in North Carolina. You can look across our long history here. And when we as a state recognize that we've got a problem, North Carolinians come together, identify the problem, lay down their differences, and roll up their sleeves and go to work and fix it. As I travel around the country and people ask me, how in the world did you, Blue Cross, and UNC Healthcare System get together to build a fabulous new clinic that's moving the needle on higher quality and lower cost? What's the secret sauce? Well, leadership matters, and Bill Roper is a dynamic and progressive thinker. He's the leader of the UNC Healthcare System. But the key is, that's what we do in North Carolina. That's who we are. We come together and solve problems. And I tell my colleagues, I hope that you can ultimately do the same. Innovation, collaboration, that's what the key to drive and make sure that this revolution brings us to where it is that we need to be. And as we kind of look towards the end of the thematic part of our conversation this morning, I want to leave you with a couple of other pieces of data. You've heard the word consumerism. That's where the healthcare space is going. And I want you to think about your own experiences with healthcare in the context of consumerism. If any of you have had to have surgery, or as some of you think about sometime in the future that you may have a significant medical experience that needs to be addressed, let me ask you these questions. Did you know in advance of the procedure what the total cost was going to be? Could you figure out how much that either you were going to have to pay or how much your parents were going to have to pay and how much the insurance company would cover? Did you go online and shop for the facility or the surgeon the way that you would shop for any other significant event or investment in your life? Did you compare the quality outcome data that is publicly available against the cost of that which it is that you need? Now, part of the confession here today needs to be that all of us in the healthcare system have not made that transparent to all of you good enough, fast enough, and well enough in the past. But that is now changing, and that data is going to become richer and more readily available to you so that you can take more responsibility for your health care decisions. Think about this fact. Forbes magazine says that the lack of information about health care purchases drive up cost for the country by $100 billion a year. You could pay for a lot of health care with $100 billion. So what are we all doing about it? A couple of examples that are happening here in North Carolina in our company. Many health plans, including us, now give our customers, our members, access to price and quality information online. Today, you can go, if you're our customer, go and we have a treatment cost estimator that will allow you to see average cost for hundreds of medical procedures. And we're moving this information to the mobile environment. We have a mobile app called Health Nav that helps you find the nearest urgent care center if you have a need for one. You can view claims and benefit information on your telephone, and you can certainly learn more about the cost of treatment and prescription drugs. Let me leave you with a thought. You may have asked yourself, is this enough? No, it is not enough. These are just a handful of the things that are going on here in North Carolina, but there is so much more to do, and we've got to be about it. What concerns me most about the healthcare revolution is that we're not moving fast enough. We are not acting with a sufficient sense of urgency. The end of the decade will be here in a flash, and that $1 out of every 5 in your pocket is going to evaporate in healthcare costs if we don't get our mind around this. Now, change is hard, and it takes time, but the clock is ticking, and we do not have time to wait. So let me leave you with an assignment. There's no specific due date, but it is certainly an urgent task that you can start engaging this afternoon in helping us build a sense of urgency and continue this revolution. First of all, take better care of yourself. Poor Richard told us a long, long time ago that an ounce of prevention is worth a pound of cure. And it has never been more true than it is to date. And for the students, whatever career path you choose, and this assignment goes for all of us, be informed, stay informed, learn about the healthcare system so that you can assure yourself that you're getting the best value out of what it is that is available. And some of you are going to end up with careers in the healthcare space. And that would be a great thing because we're going to need all of you to help us figure this out. But whatever your role in working America might be, students, you're going to be a lifelong consumer of health care. And you are going to need a system that needs a lot of work before you start consuming health care at the rate that I'm now consuming health care. And the big bill will be on your back if we are unsuccessful about this. So please stay engaged and help us think through all of the solutions. I do believe that today we are in fact writing the prescription for a better health care system. But again, students, it's going to be your generation that finishes the job and will actually get it right. And what gives me great confidence is that I know that you're up to it. That's also a characteristic of North Carolina and our country. So as we move forward from today, remember collaboration, innovation, and cooperation, the keys to a better prescription in health care. Let me say to the Chancellor, the Deans, and the faculty and the students of Appalachian, thank you for providing me the opportunity to come home today and spend a few minutes hopefully stimulating and providing you some provocative thoughts to contemplate. It's great to be a mountaineer. Thank you very much.
Thank you so much, Brad, for those inspiring, provocative, and very insightful comments. Mr. Wilson has agreed to take some questions from the floor. We have some microphones down here. We also have some students who are walking around with a portable mic and and will recognize you. So please, anyone.
Shall I just go ahead?
Yes, ma'am.
Well, Mr. Wilson, I am so glad to hear your words and to recognize you as an alum from my department. I am Lucinda McCrae. I'm chair of the history department.
Great.
I'm also a historian of medicine, and I'm very grateful for your comments. I think that you pointed out a lot of the historical developments that have gotten us to the place we're at right now. I'd be interested in hearing you say more about some of the things that you alluded to in your talk, one of which is to change the incentives in the healthcare system. Seems to me that we still have a system where people get paid when some kind of intervention occurs. And so we do a lot of over-treatment and a lot of over-testing, and rather little emphasis can be placed on public health and prevention because so much emphasis is placed on intervention. So that would be one area that I'd be interested in hearing you talk about. Another is the area of outcomes-based medicine, which you alluded to. This is something that I truly believe has kept costs down in some other countries, where folks are more attuned to using protocols for various kinds of prevention and treatment. So thank you again for your comments.
Well, you've got several questions in there, and they're all good. And let me parse through and try to speak to the two fundamental pieces that you highlighted, and that is prevention. Part of what is changing and the relationship, the payment relationship between insurers and the medical community is in fact changing such that more money, rewards, whatever code word you want to use for the consideration for the wonderful services that our healthcare professionals provide, are quickly moving to rewarding for outcomes. So those that are in fact have a chronic condition or are sick, that the metrics are available and continue to grow where you can, for example, let me use Carolina Advanced Health. They focus on 6 chronic conditions that are typically pervasive in our society, like asthma, for example, or diabetes. And the folks that work at Carolina Advanced Health are on salary, so they don't have to worry about volume relative to a baseline income. And then they are rewarded on top of that for specifically improving patient health. There's a very complicated, it's complicated to me, equation that is deployed at the end of the year, and Rand helped us develop this, which takes an outside of Carolina Advanced Health cohort health status and compares it to the health status of those inside of Carolina Advanced Health, to the end that you can measure to see that those patients are getting healthier, faster, better, quicker, and cheaper than the world at large. And as a result of that good work, then the medical professionals are rewarded on top of the base salary, if you will, for that outcome. Now, I believe that that's where the world is going, and that one of these days that's going to be the predominant financial model in the healthcare space. We just don't have enough of it now. Now, back to prevention. One of the good things that the ACA did, it didn't do enough in my opinion, but it does put some highlight on prevention. And the products and services that we are developing at BlueCross BlueShield in North Carolina, and incentives, not so, for both the provider as well as the customers, that if you deploy prevention measures, you are rewarded for doing so. For example, in our company, we provide health insurance for our employees, but each employee has to earn $750 towards the piece that they contribute to that health care plan by doing certain things, and they're all aligned around prevention. So I give you a very specific example. If your BMI is over 28, then you have to demonstrate progress towards getting to 28 by 5% during a period of time in order to earn $250 of the $750. There are employers across North Carolina. Let me hold up BB&T. They have really been a leader in our state in developing products that incent and reward employees for healthy lifestyles, healthy behavior, and using the insurance product as a preventive measure. What we find, however, and then I'll close with this thought, is many people don't know or think about using their health insurance product in a preventive way. They wait for the train wreck. And I think part of the revolution that we are about here is back to consumerism. We're all going to have to spend more time getting smarter about our own health and how to appropriately use the health insurance product and also the health care system, and simply not live our lives at 180 miles an hour, and then when we have a problem, expect the magic pill to also all of a sudden make it all better, and that's going to be part of the journey. We are very much engaged in our company, and I know Blues across the country, trying to educate people not just about the ACA and what all that means, which is a seminar in and of itself, but how to appropriately use and deploy that which you already own to the end of better health. So I hope that at least got close to your questions. Other questions? Look. Okay, yes, we're up there. Yes, ma'am.
Hi. Can you hear me? I'm a current BlueCross policyholder,
Right.
and my question is specific to the increase in my premium, which I pay now, and the projected premium, which is available on the website. Currently, the policy that I hold is $224 a month, and through the online BlueCross tool, I'm being told that my policy is going to be $591 effective January 1st.
Right.
Could you speak to that drastic increase?
Sure. Now, if you want to parse your individual circumstance, we need to talk on the side because each individual, everyone's different. But let me speak to it in the generic. Absolutely, and I can. 2/3 of our customers, and this is an ACA-centric answer, so let me say that right at the outset. 2/3 of our customers, BlueCross BlueShield customers, are receiving either no increase, a decrease, or an increase that's more in what you would call the normal range, whatever that means, usually low double digits or high single digits. 1/3 of our customers, and you're in that space, are seeing increases like that. Now, while, again, I can't parse your individual circumstance, but the general answer is this. The ACA requires that there be benefits in the products that are eligible for sale on the exchange as well as off of the exchange that you didn't have before. Whether you need it or not, and whether you want it or not, you got to buy it. Let me give you an example. Everyone has to have maternity coverage, period. Whether you're a 4-year-old girl, a 60-year-old male, a 42-year-old female, or a 32-year-old female, or a 32-year-old male. We have to price for that, and we can't take it out. Another impact provision of the ACA is that under the law, we cannot charge more than 3 times whatever our lowest premium is. It's called the age band. So those of us who are, I'm 60, my premium can't be more than 3 times what my son's premium would be, who is 27 years old. Guess what? For those on the lower end of the spectrum, regardless of your health, those on the lower end of the spectrum, it gets increased disproportionately to the decrease for those on the upper end. Also embedded in that premium is the health insurer tax, a new tax by the federal government on insurers. Our portion of that tax, on top of that which we already pay, not complaining, just giving you data, that's an additional $78 million. On top of last year, we roughly paid $130 million, state, local, and federal. Add another 78 on top of that. There are other components. I could go on, but those typically are the 3 big ones that hit that premium. And I am certainly sorry for that experience and would be happy to, again, have a sidebar, get some information and connect you with one of our folks that might help you soften that blow, if you will. But my suspicion is that my answer is going to be highly relevant to your individual circumstance and increase. And that's happening all over the country. It's not just North Carolina. That is one of the adverse consequences of the ACA. Not being critical, just being truthful.
Thank you.
Hope that helps.
Yes, thank you.
And please come down and let's exchange some information before we get out the door. Other questions? I'll look to the Sergeant at Arms to keep us honest on time here. Okay, we got guys with two microphones. All right, maybe we can get two if they're short, and I'll try to not talk so much.
Mr. Wilson,
Yes.
since it is the law of the land, aside from the web interface and repealing it, is there an aspect of the ACA that you think could be improved to get us a better prescription for health care?
Yes. I would increase the age band from 3 to 1 to 5 to 1. I would extend the grandfathering period, and we'll get highly technical here. If you did not change your health insurance policy after March 23rd of 2010, you didn't make any changes, then you can keep the old. What I would do is say, change that date, and this was an idea that one of John's team members had this week. In fact, we shared it with the White House. Extend that through December 31 of 2013. My guess is the woman who just asked me that question, she could stay on a grandfather policy and keep that 200 and change premium versus jumping to the 500. The folks that already have insurance are being disproportionately impacted by that. That would be the second thing I would do. The third thing I would have done is I wouldn't have gone live October the 1st with a technology system that is struggling mightily at best. And the list goes on, but if I were king this morning, there would be my magic wand wave. All right, can we get this one real quick? If the answer's too long, I'll do it on the side. Okay.
I think it'll be short.
Okay.
I'd just be interested in your thoughts on the pharmaceutical industry, pharmaceutical advertising, and the impact on healthcare in general and the cost.
Okay. So, again, let me continue to be king for a minute. I enjoy that. That's pretty nice when you can declare yourself king. I would eliminate pharmaceutical advertising. Now, let me just say to you, I've got a lot of good friends in the pharmaceutical industry, and I like them all, and we get along well. And my goodness, how we have benefited from a lot of the therapies that they have been able to create and deploy in our country. But you can mark it on a chart, and you probably have. Those of you who are faculty members and talk about this stuff, you can draw a line on a chart, pre-media, pre-television advertising, and post, and pharmaceutical spend in this country has gone straight up. Well, even somebody that's not as smart or with numbers as I am can figure out something happened there that helped accelerate that. And in fact, I've had the opportunity to go to France and England and study their healthcare systems in some depth. And their pharmaceutical czars in the French government and in the UK, they would answer your question the same way that I did. They said, what are you doing with the advertising? Pharmaceutical spend is a big challenge. It is a huge portion of the healthcare cost, and we're going to continue to have to work hard with that, particularly specialty pharmacy. I mean, the cost of some of those drugs are just unbelievable. And the questions are valid. Are they worth it? The bang for the buck. And I'll close by saying this. We're going to have a real intense, serious conversation as a country about end-of-life care. Now, that's a touchy subject. I understand it, that it's touchy. But if you look at all the other, or many of the other developed nations, they've had that conversation, many of them, and we haven't. And with the graying of America, and I'm part of that wave, it's something that we need to call time out and think about. And I'm not talking about death panels or setting up some kind of entity that gets to make judgments about people's personal decisions. But as families, we've got to have that conversation, because the spend on the last 10 days of life is quite astronomical. Not saying that it's not worth it. Don't go away from here and say that. If you do, you misunderstand what I'm saying. I'm just saying that we've got to evaluate all components, and that's one of them. And as a country, I would encourage us to have that conversation and think about it around our kitchen tables. That's something we can do today. again, enjoyed being with you, and hope we win the game Saturday. See you.